Hi, I'm Raymar B. Calyado from Section Weidenbach. For this video, I will perform rectal instillation. But first, what is rectal instillation? Rectal suppositories are used primarily for their local action, such as laxatives and fetal softeners. Systemic effects are also achieved with rectal suppositories. It is important to ensure the suppository is placed past the internal anal sphincter and against the rectal mucosa. For the assessment, assess the rectal area for any alteration in integrity. Assess the recent laboratory values, particularly the patient's WBC and platelet counts. Patients who are thrombocytopenic or neutropenic should not receive rectal suppositories. Assess relevant body system for the particular medication being administered. Assess the patient for allergies. Verify patient name, dose, route, and time of administration. Assess the patient's knowledge of medication and procedure. Assess the patient's ability to cooperate with procedure. For the objectives, first, to instill directly the medication suppository into the rectal area. Second, to provide means for rectal evaluation. Third or last, to obtain desired therapeutic effect. The equipment used for this procedure are suppository, water-soluble lubricant, clean gloves, and medication card. Step 1. Gather equipment. Check medication order against the original physician orders according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. This comparison helps to identify error that may have occurred when orders were transcribed. Step 2. Know the action, special nursing consideration, and safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder, and can also be used to educate the patient about the medication. Step 3. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in medication area. Organization facilitates error-free administration and saves time. Step 4. Transport medication to the patient's bedside carefully and keep the medication in sight at all times. Careful handling and close observation prevent accidental or deliberate disarrangement of medication. Step 5. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and helps prevent errors. Step 6. Explain procedure to the patient to gain cooperation and to allay anxiety. Step 7. Perform hand hygiene and wear gloves to prevent the spread of microorganisms. Step 8. Assess the patient to his or her left side in a seams position. Drape accordingly to only expose the buttocks. Allows for easy access to anal area. Left side decreases chance of exposure of the suppository. Proper draping maintains privacy. Step 9. Remove the suppository from its wrapper. Apply lubricant to the rounded end. Lubricate the index finger of your dominant hand. Lubricant reduces friction on administration and increases patient's comfort. Step 10. Separate the buttocks with your non-dominant hand and instruct the patient to breathe slowly and deeply through the mouth while the suppository is being inserted. Slow deep breaths help to relax the anal sphincter and reduce discomfort. Step 11. Using the index finger, insert the suppository round end first along the rectal wall. Insert about 3 to 4 inches. Suppository must stay in contact with the rectal mucosa for absorption to occur. Step 12. Use toilet tissue to clean any stool or lubricant from around the anus. Release the buttocks. Encourage the patient to remain on his or her side for at least 5 minutes and retain the suppository for the appropriate amount of time for the specific medication. Prevents skin irritation, prevents accidental expulsion of suppository, and ensure absorption of the medication. Step 13. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Step 14. Assess the patient to a comfortable position. This ensures patient comfort. Step 15. Evaluate patient's response to the procedure and medication. The patient needs to be evaluated for any adverse effect from the medication or procedure. For the evaluation, first, patient cooperates with rectal or suppository instillation. Second, desired therapeutic effect is obtained. Third or last, experiences no adverse effect, including allergy response, systemic effect, or injury.